Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to update you on developments in dentistry across the UK this week. Well, we've had new standard operating procedures and equivalents across the UK, plus a new national lockdown in England and an election, although maybe not the one you're thinking of, all of which have generated a lot of questions for us this week. The new national lockdown for England, announced by the Prime Minister last Saturday, of course, came into effect on Thursday this week. Well, given what happened with dentistry during the first UK lockdown, there was an understandable degree of anxiety at the beginning of the week. However, we were pleased to reassure you on Monday that dental care is regarded as an essential service, that practices can remain open to treat patients throughout the lockdown, and that patients can travel to access dental care. This confirmation came from the CDO for England, Sarah Hurley, who referred dentists to the recently revised standard operating procedure and the National Infection Prevention Control dental appendix. Practice and patients were relieved to see dentistry continue to operate. We were also critical of central government communications with uncertainty immediately after the Prime Minister's announcement. In the words of our chair, Eddie Crouch, given the rigorous safety protocols we work to, there never should have been any doubt. CDO also confirmed via the Department of Health and Social Care that the dental workforce should qualify as essential workers. This means that dentists and their teams in England can receive prioritised COVID testing, which you'll know we've been calling for a number of weeks now. We also continue to work on the NHS contractual framework for England and expect to be able to update you on that in the next week or two. In the meantime, we're continuing to encourage practices to deliver the same levels of NHS care as previously. This week in Scotland saw a return to dentists being able to offer the full range of NHS treatment. Well, we expressed concern that it's not the time to be extending the range of care whilst the virus transmission remains high, and we've urged Scottish Government and NHS boards to manage patients' expectations. We need it to be clearly communicated that whilst practices will look after their patients, this is not a return to business as usual. As part of the reopening, the COVID support payments have increased slightly. Part of the new announcement was that dental practices will need to begin to demonstrate that they're meeting minimum activity levels. We're continuing to discuss with Scottish Government those activity levels and other aspects of that remobilisation in Scotland. We've updated our toolkits for England, Wales and Scotland to include the latest guidance from the recently revised standard operating procedures, the new infection prevention and control guidance and the SDCEP review. Our toolkits are designed to support you and your team's practice as safely and efficiently as possible in the context of the COVID-19 pandemic. Toolkits have proven incredibly popular amongst members and have already been downloaded nearly 40,000 times. The latest versions address your queries on things like aerosol generating procedures, fallow time, air changes, risk assessment for pregnant staff, as well as advice on job retention and the worker support scheme. We'll link to all three toolkits, plus further advice on practice management and risk assessment beneath the video. Like many organisations, the BDA's usual business carries on largely on a remote basis. Today, we were at Northern Ireland Council. One key agenda item there was shaping the future of dentistry and oral health in Northern Ireland. And next week, there will be a range of highly significant meetings, including with the Department of Health, to discuss revised operational guidance at practice level. That will include support scheme funding, expectations around activity levels, and how prepared practices are to attain lower fallow times. As ever, we'll keep you updated on the outcomes and the next steps we intend to take. As we enter the second national lockdown in England, and we have ongoing constraints across other countries of the UK, patients understandably have questions about dental practices being open and what they can expect during this time. We want to help get the message out to the UK that practices are open, that they're safe, but that patients will need to be patient. So we've updated our Advice for Patients page on our website to help them understand the situation. There are also a number of new assets for members to download, which include text copy for letters or for your website, posters for your windows and Facebook images to add to your logo and to share on social media. You'll find a link to all of that content below the video. 6 seats on the BDA's board are now up for election. You can find the full list of candidates in the link below. This year, 14 candidates are standing for the 4 regional seats, 34 candidates for the 2 UK-wide seats available. Ballot papers are being delivered to all members, and if you've not received a ballot paper by the 12th of November, please get in touch. Details again are under the video to request a replacement form. Ballots close at 12 noon on the 26th of November, so please ensure you return your vote via post in good time. Well, that's all from me this week. I'll be back in a fortnight with more news and developments. Until then, have a safe and healthy weekend.